Another area to manage is mobility. So stress, pain, mobility. And one of the techniques that's shown to be super useful is myofascial massage. So it's been shown to be extremely useful for restoring upper limb mobility following breast cancer surgery. And, a lot of it is really you're creating slide and glide between all those layers of tissue, because if you remember from the surgery, they get very dried out, they get very adhered, and myofascial work helps to restore the fluid, the hyaluronan, it's such a tongue twister, um, that exists between the layers of fascia, especially the deep layers of fascia. And so if you can help promote that slide and glide between the layers of tissue, then it has an easier chance of being able to stretch and be mobile, and it doesn't have to burn your hands out. So mobility management, myofascial work is really useful for this.